Welcome to Module 1, Review of Youth Suicide Prevention. In Module 1, we will be covering what we learned in the first class. We will review Dr. Joyner's theory, warning signs, risk factors, how to have that conversation, and what type of language and listening skills do we have to have in order to keep someone from taking their life. Suicide clues and warning signs are extremely important, and we must take them all seriously. In Dr. Joyner's book, Why People Die by Suicide, that we read in the last class, he said there is no single cause for suicide. But he had 3 reasons why he feels that people die by suicide. Feeling like they're a burden to others, not feeling like they belong or fit in or have a purpose in life. But most importantly, they have the ability to take their life. So we need to make that very difficult for them. The foundation for suicide is depression and stressors, according to Dr. Joyner's theory. There are different types of warning signs. Direct verbal clues. We will see most of those in our older adults. But a lot of times we still see kids say, if such and such doesn't happen, I'll kill myself. If you hear that, you need to teach them another way of expressing themselves, asking them to use some different words. Indirect verbal clues you will see in older adults and our adults more than our youth. Behavioral clues we will see in our youth. Giving away prized possessions is really big. If you hear about or see someone giving away all their connections to the outside world, you need to question why. They will begin to separate from friends and family, their activities. Sometimes their grades will go down in school. Sometimes their attendance will be sketchy. Situational clues. The number one reason why people take their life nationally is due to major relationships. So we need to really work with students that have a lot of loss in their life. Risk factors are not warning signs, characteristics or conditions that increase the chance of suicide. If you know of someone that has an immediate family member that has taken their life, or a friend, or extended family member, or has had suicide attempts or self-harms in the past, you need to connect with them right away. Self-harm is a prerequisite to suicide. So how do we have that conversation? Well, we have to know proper language skills, and we need to learn to listen. The language we use nationally is died by suicide. A lot of our youth and our college-age students are using the word unlived myself. But nationally, they're saying that you need to say died by suicide. The way you talk to someone, that your language skills, your body language, your nonverbal signs are really important, because they see that as saying they care or they don't care. So listen without judgment. Don't give ultimatums. Ask permission before giving advice. Always follow up. Remember, people don't want to die by suicide. They just want the pain to go away. So as an overview of Module 1, we discussed Dr. Joyner's theory. Feeling burdensomeness, feeling that they don't belong or don't have a purpose, but also having the ability to take their life, and having a history of depression. Proper language is extremely important. We need to use the words died by suicide, and we need to do more listening than talking. Risk factors are not warning signs. They're the characteristics that give a person a red flag for suicide. Conversation is a connection with a student. We need to make them feel hopeful, and we need to help them get through the stressors that they're going through in their life. So reinforce hope. Suicide is preventable. Next, finish reading the text through Chapter 4. Answer any discussion questions and continue the discussion throughout the 4 weeks. Then take the quiz. Once you've received 100 on the quiz, you can move on to Module 2.